So you are injecting stem cells for people that have a problem with achieving orgasm and urinary incontinence.
Exactly.
What are you doing? What is this?
So we're basically pulling fat out from patients in select areas and then re-injecting it. And the fat does contain stem cells and healing factors into the vaginal area. It could help with orgasm. It could also help with urinary incontinence.
Now, why is it helping with orgasm?
Well, it basically increases all the tissues down there and the healing that has basically waned and decreased with time. So as the body ages for women, the tissue down below begins to undergo atrophy and a lot of the changes that actually stop the orgasm response. The tissue becomes dry, it becomes brittle, and so by injecting fat, which is very rich in stem cells, it increases blood flow to the area and sensation.
They love this?
They love this.
And this is one of your most popular procedures?
This is very popular.
How soon do they say they feel a difference, where they sneeze and they're not having urinary problems?
Some patients within a few days. And remember, because it's the patient's own body, this continues to kind of grow and develop and heal over time. So the patients are having further procedures out and tracking them out 3, 6, 12 months and having great results for long periods of time.
So because, as you mentioned on other interviews, that it's a friction issue, right? So when you tighten that area, they're able to have a better orgasm?
Absolutely.
Is that what we're talking about?
So when you think about it, the vaginal vault is more like a room. So we can't just identify one wall to treat. We have to kind of identify and treat all the walls to increase the friction. We're basically decreasing the diameter in such a way the friction goes up and therefore the sensation goes up, Randy.
So they do it once, they do it twice, or they do it over time, like every year or so, every couple of years?
Well, just like when we get our haircut, there's always maintenance. There's procedures that can be done in addition to doing the O-shot or doing fat vaginally. And I think it's all about having that really good relationship with the physician so that you feel comfortable partnering with them for the long term. Because things change, as you know, over time, even with the best procedures.
Now, a lot of dermatologists doing this, plastic surgeons doing this. You must have a bias. You know, you work in this area as a GYN. Is that who you think, if you're going to do this? And I know there's qualified people doing this, but go to a specialist?
Absolutely. I think that, you know, for a GYN, this is the space that we are trained to work in, and we are able to basically look at other solutions, not just one solution.
Other factors.
Other factors, other solutions, other conditions. You know, a lot of times the patients might need another concurrent procedure, and we are able to do that. They might need surgery in addition to...
So why then go to a GYN if you're going to do this procedure?
I think
is there an advantage?
Absolutely. So I think that this work it's just so highly specialized. You could have the bladder falling. You could have other conditions that are mimicking what your symptoms are. And by going to a GYN surgeon or going to a GYN specialist, then we could actually pick that up. Is your pap smear normal? I mean, there's so many different kinds of GYN specific issues that need to be kind of addressed with in the beginning before the procedure is done. So I think we really are the experts in this space.